Welcome to Chad the Home Care Guy. Real conversations about aging, home care, and the decisions families face every day. Hosted by Chad Fisher, founder of Avail Home Care. Because caring for the people you love shouldn't be confusing. Let's get started.
All right. Hey, everybody. This is Chad, the Home Care Guy with Avail Home Care, and I'm back with you guys today with a new guest, Oya Galati, and
Hello.
she is with InnovAge. So if you've never heard or seen this place, it's pretty incredible. I took my first tour not that long ago, maybe a little over a year ago, something like that. And it's a game changer. So here is Oya, and really what I want to learn about first is probably just a little bit about you and where you're from, and then also tell everybody kind of like how you got into working not only in the industry, but working with seniors, because I think that's really important to understand what got you here.
Yeah, sure. So I am an upstate New York native, moved to Lakeland to get out of the cold, grew up in Lakeland, Polk County most of my life. School in Gainesville, so I'm a Gator, go Gators. And I found myself in the field of physical therapy.
Okay.
So I am a PT assistant by trade. I worked for Tampa General in the outpatient rehab world for about 10 years. Not just seniors, all ages, but I absolutely love patient care. It was where I got my, my foot in the door with healthcare. Fast forward to COVID, having my second child right in the middle of the pandemic. I took a couple years off and I thought, why don't I try the world of sales and marketing? Because I actually have a degree in marketing as well. So I joined my two things, healthcare and marketing, and I found myself in home health.
Okay.
Spent some years at Trilogy doing home health care sales, chasing Medicare referrals all over
A
town.
lot of chasing.
So it was a lot of a huge learning experience of the back end of healthcare coming from patient care. But it was nice that I had that, that medical terminology in my pocket. It came in handy a lot in my marketing days. So
That's cool.
then I thought, okay, Medicare referrals are really hard to find. They're a dime a dozen. So I was like, where can I go help the underserved community? Found myself at InnovAge, and I thought this is exactly what I've been looking for in a patient population that's very underserved.
So tell everybody a little bit about the company, how it got started, and then it's part of the PACE program as well. Many people don't know what that means. I didn't even know what PACE meant until recently. I had to look it up to understand what it was, but tell a little bit about the company and then what PACE is.
So PACE literally stands for Program of All-Inclusive Care for the Elderly. I had no idea what it was either. And
it's not an easy one.
No. And it's a nationwide thing that's been around. Actually, InnovAge has been around for 30 years.
Okay.
We're in 6 different states, but we're newer to Florida. So that's why a lot of people in the area are like, what? What is this?
Did it have a partnership with TGH?
So we are now in a partnership with TGH.
Okay.
Yep, that's a recent acquisition. It's been incredible to be teamed up with them. But yeah, InnovAge is a PACE provider. There's many PACE providers throughout the nation. We're actually the largest. We span 6 states. We're in Tampa and Orlando. We cover 3 counties here in the Tampa area. So
you're meeting families in pretty much the most stressful environments when they're coming to you guys.
Yeah, no, I feel like a social worker. I'm getting these people, when they're desperate for help.
Yeah.
They might not have the means. They don't know where to start. I mean, you guys know.
Yeah.
They're coming to a crossroads with caring for their loved ones, and they don't know where to start. They don't know what things cost, what insurance will pay for. So I do help guide them, if not with our program, but to other sources in the community. That's why I'm grateful for you guys.
Yeah, we work together a lot.
We definitely all need to support each other. But we're just, we're a hole in the system that I think has been there for a long time. So I'm just glad that we can serve that.
I feel like the hole is huge. And until I really knew what you guys were and what you did, I didn't know how to fill that void as well.
Yeah.
If you don't have that resource, which I'm like a sponge, always trying to get resources so that we can take care of our clients and people that we meet, even though some of them don't sign with us.
Right.
I at least want to know what I can do with them if they don't. So we still have options.
Yeah.
So how long has the company been around as far as in our area at least?
We've been enrolling for 2 years here in Tampa, and we enroll probably about 10 to 15 new participants each month. Once we find a good fit, there's a process to get them in the program. But once they're in the program, it's amazing because they're getting out of the house, they're coming to the day center, they're socializing where they used to maybe be isolated. They're getting to the doctor, whereas before they weren't able to get to the doctor. They don't
Yeah.
have transportation. They're getting to specialists, they're getting their medications managed. So it's kind of like these people who are falling through the cracks, we're helping to put the pieces back together. So that's the greatest part of it.
So transportation, talk about that.
Transportation, huge.
Yeah.
We'll bring them to and from our day center up to 5 days a week. Morning drop off, morning pickup, afternoon drop off.
Is there a certain time frame the day center's open and close, or is
It's
it?
a Monday through Friday, 9 to 5 kind of
Okay.
deal. So it's not, there's no live-in facility. We are
Sure.
just a day program.
Yep.
So it's a way to age in place. It's a way to keep, mom or dad living at home, but maybe, they don't have the support they need during those working hours. So they can come be with us under medical supervision, socializing, all of the things.
Okay.
And then we'll also transport them to specialty care, dialysis if they need it, anywhere that
good.
they see in the community.
Yeah, that's great.
Yeah.
Because transportation, I touch on that in some of my videos as well, where transportation is, I think, one of the highest growing complications,
Mhm.
I'll call it. It's one of the
Mhm.
highest complications that we're seeing, no
Mhm.
matter where you live, what
Mhm.
state you're in. I think transportation becomes a huge problem.
Absolutely.
And there's only a few programs out there that you can call on that'll
Right.
actually take you, pick you up, and take you places.
Yeah,
So
it's important.
It's very important. What are like two or three of the probably the most misconceptions that you hear when you talk to people about the program or the company itself?
I would say misconception. They think we're just an adult daycare.
Yeah.
They hear day center, adult day
I
services.
think that's what I thought when I heard the very
And
beginning. I think that's what
when
I
I hear
heard too.
adult
So,
daycare, I think, my kids went to daycare. I think of,
yeah.
a bunch of people sitting in a room and someone's just watching them.
Yeah.
It's not that. I mean, we have a wonderful, huge day center where there's numerous activities, a full-time recreational therapist, bingo, Zumba, gardening, you name it. But you marry that with the medical piece. So their primary care is on site, their dentist is on site. They get physical and occupational therapy in a huge gym. We're taking them on outings. They have a podiatrist that comes in and rounds vision and hearing services. So imagine while you're at daycare, you're also checking off all these medical appointments that you
Right.
need to get done that have been neglected. And normally you'd have to drive from here to there and all over town to get to those appointments. So it's extremely convenient. So
Yeah.
adult daycare, I don't love that term. That's probably one of the bigger misconceptions. Um, that's probably the main one.
Yeah.
Yeah.
Okay. What about meals? Do you guys do anything with meals? Do you handle? I know they're there, especially if they're there during that portion of the day.
Yep.
You probably have a lunch or something, but
Mhm.
what does that look like? Is there a cost to any of this stuff, or
Zero
what's that look
cost. Like not a penny comes out of pocket for
Really?
anything. While they're at the center, breakfast, lunch,
Oh, they
outside
get
of
2
the
meals.
center. Yep, yep. Outside of the center, and we have a full service kitchen. We meet any dietary restrictions or needs.
Okay.
Outside of the center, they're eligible for frozen meals up to 21 a week
Okay.
that are delivered. And we also do a monthly food pantry. So they're going home with loads of free groceries once a month.
Okay. What about location as far as like a bubble? Are you guys statewide? Who do you look for as far as distance of how far out that you're looking for people to then
Mhm.
come in? And then maybe with the bus as well, like how far out will they go to pick people up to then bring them in?
Yep. So our center is located very centralized in Tampa. We cover the whole county of Hillsborough County, Pasco, and Hernando. Typically, a bus ride shouldn't go over an hour, but
Okay.
usually on a good day, we avoid traffic hours. That's going to be our span, those 3 counties. That's just for our Tampa center. Orlando's another story, but for our purposes, it's Hillsborough, Pasco, Hernando County lines.
What are some outreach strategies that you guys use in order to find people? Because just like us, we have to go to marketing meetings. We have to try different things.
Yeah.
We dabble in just about everything just to make sure that we try and hit, everywhere we can to get those referrals.
Right.
But
Yeah. I mean,
what's it like for you
it's great
guys?
working with private duty because, like you said, if they can't work with, private duty agency for one reason or another, maybe they don't have the resources. I'm happy to step in there. Placement agencies too. If patient is not quite ready for assisted living, maybe they can age in place for another year with our support. That's a huge one as well. Obviously, hospital case management, rehab facilities, skilled nursing facilities. We're also out in independent living communities, so seniors that live in an apartment building, but maybe they live alone and they want a little more support and socialization. That's a big one too.
Okay. Size is the facility? Like how many people can fit in there in one day? And what's that look like as far as a census for you guys?
And so I think we have capacity of 1,200, but our census right now is around 200. So we're accepting, I mean, there's states where we're located where we're on wait list.
Right.
I anticipate we'll get to that point, but we're still newer. Our facility is 40,000 square feet. Not every participant comes in every day, though. So on any given day, I mean, currently you can walk in, there might be 30 people in the day room. It's never overcrowded. We have so much space to spread out. And like I said, people are going into the doctor or the therapy, or they're going out to see their cardiologist. So there's a lot of moving parts, and we're also servicing them in the home too, if
Right.
needed. So
Okay. Tell me a little bit, and I'll put you on the spot just for 1 second. Tell me, is there a certain person, not naming any names, but any story that hits home of somebody that you have touched
yeah,
comes to this?
yeah. Yeah, absolutely. I mean,
I think everybody's got a story.
I have so many, and I've been so
Give me a couple of them then.
rewarded. I mean, no, this job is incredibly rewarding, and it's really the main reason why I do this is that these folks are so lonely and so helpless. But I did have a guy over the holidays. I was literally trying to get him enrolled for January 1st, and he was in the process. He was in the midst of getting a prosthetic. He was an old vet, very, didn't have anything, was living in very dire conditions, but he was trapped in his house. He had 3 steps to get in. He was wheelchair bound, and he was literally waiting for this prosthetic. And if we could show that he could get out of his house with the prosthetic, we could get him in the program January 1st.
Okay.
So I'm at his house. He got his prosthetic delivered on December 30th.
The PT side of you comes
I
out.
came and I was like, I will stair train you. I will get you out of this house. And sure enough, I went, helped him get his prosthetic on, and he was able to, with our help, get out of his home for the first time in months and start coming to our center. And now he's there. He's getting help with, bathing. He's getting help with meals. He was hungry. He didn't have anything. So
And
I
this
was
is
like,
our veterans, you guys. This is veterans.
yes. And so I just couldn't, I didn't have the heart to make him wait another month for our services. So that was one. I mean, we have others where, families are about to put mom into assisted living because they have dementia, and dementia patients cannot be alone. They need and to provide that supervision. I had a woman, she actually works at the hospital and she's enrolling her mother. And she was like, I'm at work all day and I can't watch my mom and I'm in tears because I feel guilty. I don't want to put her in a nursing home.
Yeah.
So
This is the sandwich generation.
split in. Yeah.
That, I touch base on 1,000 times in my videos. We're there. The adult children are, they have to take care of their kids, and then now they're taking care of their parents.
I
And
know.
it's like, how do you work and keep some kind of a family balance?
Yeah.
It's very tough. So,
yeah. So it's amazing to be able to be that solution.
Yeah,
for
that's awesome.
situations like that.
Really cool.
Yeah.
On a other note, as far as going out and being in the community, how far out do you have to go? Are you the only one that's going out and doing?
No,
outreach, or do you
there's
have
3 of
multiple
me in Tampa.
Okay.
And
I run into you all the time, so
Yeah.
that's why I'm asking.
Yeah, there's 3 of me, so you should see more of us out and about. We just hired a new person. I'm in Hillsborough and Pasco. I'm mostly at Tampa General.
Okay.
I've had that relationship for years, and they know me. I know my way around that crazy hospital and how to find, and I'm meeting with patients face to face. As soon as I get someone sent to me, I'm there at the bedside explaining what we can do for them when they go home.
Tell everybody how they can get in touch with you and the company and anything else you want them to know about it.
Yeah, so I'm a texter. I'm 813-898-4518. You can reach me. I can direct you if there's any questions you have about the program or eligibility, I'm happy to get on a call or meet with you. Love to take you on a tour. If you haven't seen our facility,
It's
come
incredible,
check it out.
guys.
It's
It
awesome.
was an incredible tour when I
Yeah.
took it. So
I walked in.
eye opener.
I walked in before I worked there, and I was like, I could see myself working here one day. And
Yeah.
sure enough, I chased it and I got it. So, yeah, I'd love to show you the facility, answer any questions about PACE for you, and try to help those, 55 plus Medicaid patients that you can't necessarily help that need the help.
Yeah. Well, that's awesome.
Yeah.
Thank you so much.
Thank you.
Well, again, you guys, this is Chad, the home care guy, and I am with Oya Galati with InnovAge. So stay tuned for the next episode. And for now, we are out of here. Take care.